heard of ASMR and wondering what it stands for and what it means? Well, you are at the right place. The term ASMR was first coined in 2010 in online communities as a non-scientific term for people experiencing an atypical sensory response to specific stimuli known as ASMR triggers. ASMR stands for Autonomous Sensory Meridian Response. As the name implies, ASMR is a spontaneous, involuntary sensation leading to mood elevation and sense of calmness. Typically, these sensations are electrostatic-like tingling sensations that arise across the scalp and are felt dominantly in the head. The sensations may spread and follow the line of the spine downwards and then extending into the arms depending on the intensity of the response. These sensations occur in response to various stimuli, most notably social, visual, and auditory stimuli, and are generally accompanied by a sense of calm as well as a positive affect. These stimuli usually involve repetition of movements or sounds and are typically social in nature, for example, watching someone brush their hair or someone whispering. So the hallmark features of ASMR are head-dominant tingles and pleasant and calming effect. An individual would be deemed as false positive when they report experiencing something. However, that something does not align to the hallmark features of ASMR. A common false positive feeling is freezing, which is just a chill down the spine sensation lasting few seconds that occurs while engaged in enjoyable music and other emotional experiences. In contrast, ASMR is a head-dominant tingle with pleasant effect lasting for several minutes or more. The difference between ASMR and freezing has also been demonstrated during functional brain MRI studies, where increased activity of the medial prefrontal cortex was shown during ASMR tingling sensations, but not freezing or music chills. Scientific investigations about this experience started in the past few years, with the first peer-reviewed paper on this topic published in 2015. Earlier research has shown that ASMR seems to be experienced by only part of the population, and therefore some individuals do not experience it. However, the phenomenon seems widespread. Many researchers have observed that people are aware of the sensation, but were not aware that it had a name or that other people necessarily also experienced it. Many individuals who experience ASMR actively engage with the sensation in order to relieve negative mood and to induce sleep. A study conducted ASMR capable individuals found that 80% of participants self-reported that ASMR had a positive effect on their mood. 69% reported using ASMR to ease symptoms of depression, and 42% reported that ASMR improved their pain symptoms. Evidence indicates that ASMR not only induces subjective positive emotions, but also objective physiologic responses. ASMR has been found to decrease heart rate by an average of 3.41 beats per minute and increase skin conductance. With regards to neuroimaging approach, activation in areas related to emotional arousal such as dorsal anterior cingulate cortex, insula, and inferior frontal gyrus have been shown using functional MRI during tingling sensations of ASMR. It is interesting to know that on the other end of the spectrum and quite opposite to ASMR stands misphonia, in which triggering sounds causes outbursts of anger and disgust, as opposed to the calmness we see in ASMR. Even though misphonia and ASMR have been proposed as opposite poles on the same spectrum, they also have been reported to overlap and co-occur in the same individual. Moreover, individuals with ASMR have demonstrated significantly higher scores on openness to experience and significantly lower levels of agreeableness compared to matched controls. All in all, ASMR is a complex emotional experience blending different emotional components. Further research will hopefully shed light on various aspects of this fascinating condition.